So good morning, everyone. I'm Li Lian. As Henry said, I am the co-founder and managing director of Tetsuyu Healthcare. So together with my fellow co-founder, Dr. Shinsuke Muto, I want to thank you for the opportunity to present at today's Health Tech X event. Before we dive into our sharing on the holistic community aged care model in Japan, here's a little bit of an introduction about ourselves. So Tetsuyu Healthcare is a Singapore-based health tech startup co-founded by Dr. Muto and myself. So our solutions are aimed at making good care more accessible in the long-term care sector. And we do this by making innovative and affordable software applications aimed at the ILTC sector. So Dr. Muto is a home care specialist, as Henry mentioned, who started his medical career as a cardiologist. He then went on to become a doctor to the Imperial family before joining McKinsey as a consultant. Then a decade ago, he started his home medical practice in Japan, U-Home Clinic, and it's since grown to become one of the largest home care operators in the country. So during this time, he started Integrity Healthcare, a leading telemedicine solution in Japan. Right. I, on the other hand, spent the first 2 decades of my professional life in banking before finding the light, right, and co-founded Tetsuyu Healthcare with Dr. Muto when we were doing our EMBA together at the INSEAD Business School. So the synopsis of today's sharing is that we are hoping to offer some insights into how Japan has successfully operationalized a nationwide, inclusive and person-centered aged care model. So obviously this didn't quite happen overnight. I'll kickstart by providing some background, on the ecosystem that they've built for community-based aged care. And then Dr. Muto can discuss a little bit on the challenges and issues they've faced, which is further exacerbated by COVID-19, right? He will also share about how technology, new players, and COVID itself has disrupted and shifted the balance of power, and see how this has enabled changes towards what he sees to be a more sustainable, tech-enabled model of aged care. Then I'll close with a few reflections on how we in Singapore can learn from these experiences given our own unique challenges and context. So this is a nice slide to show that Japan is indeed a super aged society. The UN actually defines a super aged society as one where the population that's elderly accounts for more than 20% of the entire population. So Japan is clearly a super aged country, right, with low birth rates and a declining population. So the red line here basically shows that those that's aged above 65 is currently at about 28.5–30%, and it's rising steadily, right? The green line, however, actually shows the population aged 15 to 64 that's supporting those that's aged 65, right? So this is clearly on the decline, right? In the 1950s, this support ratio was about 10:1. Today, it's barely 2:1, and in 25 years' time, it will reach 1:1. The biggest challenge that Japan faces in dealing with this super aged society are fourfold, right? Number one, it's in terms of government funding. How do they make it more available, more sustainable? Number two, in terms of human resources, how can the country actually maintain a sustainable workforce, right, to care for its old? Number three is the effectiveness of its healthcare policies to ensure easy access to services and a good quality of care. And lastly, how can the country basically forge a sense of cross-generational solidarity with community engagement to support aging in place? So like I mentioned, the evolution of how this age in place is being played out in Japan didn't happen overnight. So even their welfare policies have actually evolved over time, right? So in the 1960s, you could see that the aging rate was only about 5.7%. And the government actually bore the brunt, the financial burden of caring for its elderly. And over time in the 1970s, it actually became free healthcare, right? By the 1980s, I think the government realized that this was not sustainable because of the rising hospitalization rates and the number of elderly that's actually bedridden, right? So free healthcare is no longer possible, and they were slowly evolving a system of co-payment, right? And the strategy shifted away from acute care infrastructure to developing a long-term home care to reduce hospital congestion. So by the 1990s, this aging rate actually crept all the way up into the teens, and they revised this 10-year golden plan and actually built a long-term care and laid the foundation for a community care ecosystem. And then that actually meant that there were new services like elderly, nursing homes, home helpers, day services, short stays introduced. And the sector actually created new care roles, such as community care managers and home helpers. In the early 2000s, Japan actually implemented its long-term care insurance system, marking the end of free healthcare. The healthcare services choices were opened up, but the community care remains the core strategy for aged care. So in this aged care model, the home of the elderly in the center, as you can see here, is actually the focus of where the care for an elderly person is done, right? It's designed for the elderly to receive most of their care either within or around their homes. So any form of care is actually accessible within a 30-minute commute from their homes. So most of this care is carried out from their home to reduce the stress and cost on hospitals. And only if they are seriously ill, then the hospital care is initiated. So elderly who are actually requiring long-term care will actually be having a care manager who can assess their needs of this patient and match them with suitable and available services. An entire ecosystem of services and infrastructure are in place to support the elderly who can then continue to actually lead socially active, healthy, and hopefully, meaningful lives to prevent the need for them to be institutionalized for the long term. So the benefits of these systems obviously means that there are certain advantages from reducing the need for them to be in hospital for too long a time. Japan actually has one of the longest hospital stay in the world, even today, at 16.7 days. And the cost of home care, as they have found, is actually only 1/3, right, of that of the acute setting. So by changing the focus of home care, focus to home care, the amount of government spending basically has also been seen to taper off a little bit. And that's actually arrest the growth, right, of national healthcare spend. And in recent years, actually, the government has moved one step more in terms of looking at ways in which the elderly can die at home with dignity, right? As part of their regional healthcare vision, they conducted a survey, right, which shows that about more than half, right, of the Japanese people prefer to die at home, right? But in reality, only a fraction of them get to do so, right? So the MHLW, which is the Ministry of Health, Labor and Welfare, is actually working to provide resources to enable people to be able, right, to die at home. So I personally feel that this is a very progressive approach, right, that not only matches the wishes of the elderly, but over time, right, can actually contribute to optimize both welfare and medical cost. And in the last couple of years, we've also seen that the community care policy has been evolved, right, to refine and strengthen some of the very relevant care, such as emergency care, disaster medical care. As you know, Japan is actually quite prone to some of this natural disasters. So this is very targeted and important care for them. But they're also really targeting disease prevention within the community and also focusing on mental health management in a community setting, even at home. The government is facilitating convergence of care, right, for people with disabilities and the elderly under one umbrella. So this means that home help, day service, short stay, and other services is now more widely accessible to both target groups, thus optimizing resources. Right now, I'll now hand over to Dr. Muto, who will actually talk to us about the challenges that he sees faced in this sector, followed by the opportunities ahead. Dr. Muto, please. Yeah.
Thank you, Lilian, and thank you for having me at this honorable presentation opportunity. So let me explain the long-term care in intensive in Japan. So in 2016, 40% or 1.9 million adults were engaged in healthcare. And by 2025, this number will grow to 2.45 million. So given our low birth rate and population contraction, so we are facing significant challenges to fill this labor shortfall in a short time. So long-term healthcare involves long hours, relatively low salaries, and chronic understaffing. These factors make attracting and retaining staff challenging. So in 2018, the job to applicant ratio for the long-term care sector was 4:1 compared with 2:1 for other jobs. So as you know, most elderly Japanese only speak Japanese. And so having a foreign workers fill this gap is not so easy due to cultural and language differences and lack of specialized skills. Next page. Okay. So even though Japan is known for advanced technology, the majority of Japanese society is very conservative. Our population has enjoyed low cost and very good healthcare, and there has been no urgent need to change care delivery. So majority of doctors are keeping manual records even now, and care is always face-to-face. So only 1 in 3 medical clinics have EMR system. Until recently, reimbursement favors in-person care, making it not attractive for any remote care. So COVID may be a game changer as care providers find face-to-face manual disease management less feasible. The lack of integration in IT system across healthcare institutions means fragmentation of information. So this hinders knowledge transfer, productivity, and efficiency. So over time, this can translate to a lower quality of care. With many countries, including Singapore, working to consolidate efforts in system integration, so Japan has been lagging in this area. Okay, so COVID has exposed pitfalls in Japan's manual healthcare ecosystem. The lack of flexibility and government directives in fighting the virus early on resulted in cases escalating and hospitals overstressed. The lagging digitalization infrastructure obstructed centralized coordination, which is vital in mobilizing medical professionals to ensure swift vaccine rollouts and appropriate patient care. But COVID has also become the impetus for urgent change. Next slide, please. Yes. So Japan's vision for healthcare up to the year 2035 has seen the government make changes to reform healthcare to be in line with technological advancements. New laws have been passed, ranging from data protection, liberalization of telemedicine, and teleconsultations covered under health insurance. So Japan's Pharmaceutical Medical Device Agency, PMDA, like FDA in the US, has set up a group to decide on the appropriate approval criteria for solutions using AI. The government plans to introduce clear guidelines on AI-based solutions in clinical setting in the near future. Okay, so Japan is well known for the use of robots, as you know. Until recently, adoption is confined to a small pocket of providers. This trend has accelerated in part due to COVID. We are seeing more AI applications in Japan healthcare sector. Market disruptors from new telemedicine apps to patient self-care solutions for diabetes control, home-based dialysis management is changing the healthcare landscape in Japan. So telemedicine system, including Yadok, provided by my company, enables medical treatment to be better tailored to a patient's needs. Through self-directed questionnaires tailored for each disease, physicians can target relevant issues and provide very good care remotely. There is so much rich data on the patient's conditions, allowing doctors to analyze patient conditions and order timely interventions. This is cost-effective, I think, and optimizes resource allocation. I'm excited to know how far we can push this. So Yarok, at Yarok, this is a telemedicine system. It's integrated with wearable technology, such as Apple Watch and iPhone. This enables MoneyPad. It's co-developed with Takeda Pharmaceuticals to collect the live data on Parkinson's patients. So doctor monitors patients' conditions real time through the Yarok platform and can make more effective decisions. Another example is how a mobile app can assist in directing, managing, and supporting cancer treatment. Patients have the autonomy to schedule, keep records of symptoms, and access the app's library of information. So we have seen how this improves the efficacy of breast cancer treatment as a first example. Depending on the data recorded, the app can indicate to the patient whether further medical treatment by doctors is required. So Yarok is integrated with Japan's largest community healthcare network, AjiSaiNet, in Nagasaki Prefecture. So it holds 340 medical institutions and 110,000 patients. So its centralized database can be accessed by hospitals, clinics, pharmacies, and other medical institutions. So patients can access via smartphone device, telemedicine, vital signs monitoring, pre-examination symptom questionnaires, and online disease management on this platform. And Yarok and AjiSaiNet are conducting clinical studies, a lot of clinical studies on the platform to generate real-world data and real-world evidence. So this initiative has demonstrated its potential to provide a comprehensive picture of patient condition. So patients can see the effective of this model and more opt for this model of care. This is shaping up to give patients more say in the care delivery model compared to in the past, where doctors define the mode of care delivery. So Li Lian,
okay, thank you, Dr. Muto. Right. So next, I just want to very quickly share how a Made in Singapore solution, Cares for Wounds, is playing a role in Japan's care sector. So Cares for Wounds is a AI-enabled tool for wound imaging and management and monitoring. So there is a mobile app for wound assessment with automatic measurements and tissue classification, which automates and standardizes how assessments are documented, right? Then at the back end, there is a web tool that supports remote monitoring, trending, and also video consultation, right? The creation of Care for Wounds itself was done with a ecosystem of different partners, including some collaborators in Japan, Professor Sanada, whom we are actually now working on piloting Cares for Wounds, the made for Japan version of Cares for Wounds in Japan, right? So let me just very quickly share with you some of the work that we've done, and then Dr. Muto can actually explain also the progress, right, that patients have made. So we collaborated with the University of Tokyo, Todai, to create a Japan version of Cares for Wounds and piloted it right in the midst of COVID. So as you know, with a aged society like per population of Japan, there's a fair share of age-related wounds like pressure injury and diabetic foot ulcers in the community, especially in home care, right, and nursing homes. So in Japan, only specialized wound nurses are able to actually do some of these treatment, right? But most of them are attached to hospitals and specialist centers. For reimbursement purposes, however, these specialized nurses can only make a claim if it's in-person consultations. So ordinarily, because of this limited pool of specialized nurses, and also because the travel time is quite far, Japan being a big country, it is already not very easy to get an appointment for an in-person visit. So during the COVID lockdowns, this became an even bigger bottleneck, right, which actually led to not so good outcomes for wound management. So therefore, there became a very big urgent need, right, for telewounds. So together with Todai, we piloted telewounds using Cares for Wounds. So the idea was that we recruited mobile nurses making in-person visits, for these home for these home care patients. And then they teamed up with specialized nurses over at Todai, who provided this remote supervision. And we wanted to see if this could work well as in a in-person visit context. And if it does, right, and then the results can then be used to support a motion for us to submit to government for reimbursement policy review. Yeah. So I'll just let Dr. Muto then now share what exactly happened during this time. So Dr. Muto, yeah.
Thank you. So let me explain what we have done briefly. So 20 mobile nursing sites across Japan were activated during COVID-19 to conduct a hybrid, a physical and telephone visit. Mobile nurses visit patients with remote supervision from experts from University of Tokyo. So we are happy to have a fund efficiency, precision, and convenience to be the three major benefits of using care for wounds. Next, yes. So among the 20 plus patients in this pilot is a 90 plus year old patient suffering from dementia. She stayed in an aged home facility and suffers from a pressure injury after blister formation on the left lower leg. Next page, please. So her pressure injury healed after just a 7 visit by a mobile nurse supported by a remote supervision by a Professor Sanada's team. So normally the interventions would have been less timely and healing would have been delayed. This proves the effectiveness of teleurns. So overall, digital health in Japan is set to grow exponentially. This is driven by all areas of remote care from prevention, health control, and online consultation treatment or virtual rehabilitation. So this represents a huge opportunity for tech healthcare startups like us, and of course, Tetsuyu to capitalize on. So Lilian, please finalize the presentation.
Thank you. So thanks, Dr. Muto. So I think, hopefully, right, this gives you a bit of a background in terms of how Japan, right, has evolved over time and some of the opportunities. So in closing, I do believe personally that Japan remains a gold standard in the area of community care for the elderly. I've always been very impressed by how well designed the ecosystem is, allowing for person-centered aging at home and within the community. So beyond infrastructure, they've created new services, job roles. They've changed mindsets, right, and leveraged education to build an ecosystem of care. I am intrigued, by how they've evolved, progressive policies that target real and emerging needs. So this include emergency care, which is so important for that country, chronic disease prevention, even enabling patients to die at home, and incorporating mental health and physical disabilities into this care design. So I believe Singapore can definitely learn from this journey and sharpen our implementation of community care. Some of the challenges that Dr. Muto mentioned, such as lack of human resource, is something that we share. In their case, there was obviously a very slow pace of adoption of technology and, of course, digital integration. This has led to fragmentation, polarization, and obviously, sub-optimized results. In the last year or so, there's been a proliferation and increase in the pockets of innovation and disruption, which is unfolding, day by day, especially because of COVID. But with their track record, it's still not so clear if this digitization journey will actually become a mainstream. So my own personal reflection is that this is a timely reminder for Singapore, right, as we push forth in the technology adoption in our healthcare sector, and bring in a lot of new ideas, including robotics, telemedicine, AI, etc. So my thoughts or reflections are fourfold. Number one, I think without a coordinated or collective approach, even in our case, this proliferation of ideas and good innovations can actually land up becoming fragmented instead of synergistic. Secondly, also, how do we as a ecosystem of community care providers really kind of push forth a little bit more in terms of data sharing. How do we make it more accessible to integrate with public systems, even like the NEHR? How do we see public-private initiatives as complementary, right, rather than competitive, right? Number 3 would be, how do we not just look at a sustainable funding model, which is important, right, and policies to help all, right, not just the big care providers, but really all care providers, make the, not just the large players, rather take the step towards digitalization. How do we include these small providers, right, and equip them with the right mindsets and skill sets, right, to embark on this digitalization journey? So finally, I'm actually, impressed, intrigued, and excited about this idea of solidarity that we hear so much, from the Japanese people, right? It is a very compelling concept because it is really, in the end, it's really not about how individual citizens or players, right, or even one government agency winning in this game, but how do we collectively, together, right, do our part to help everyone win in this journey of digitalization. So with that, we just want to thank you, for this opportunity to share. Right, we'll open up to questions. Thank you.
All right, thanks both. I think this is a very insightful, interesting presentation.
Thank you. Thank you.
Unfortunately, we are really running out of time. So we couldn't take any more questions with regards, but I'm sure this conversation will go on. And last but not least, I just like to close the session, and a very, very big thank you to both of you from Tetsuyu Healthcare in sharing this very insightful topic. Thank you both.
Thank you.
Thank you very much.
Thank you.